I am Dawna Ledbetter. I am the SHIIP Coordinator for McDowell County. The McDowell Senior Center is the actual coordinating site, so my office is here. I also work for the Senior Center, so I'm the outreach coordinator here. I'm over home delivered meals and in-home aid and stuff like that. So SHIIP is a program under the North Carolina Department of Insurance. There's a SHIIP coordinating site in each county in North Carolina, so you know, if you happen to live somewhere else, you can get assistance from another counselor somewhere else. We give unbiased information so you can make an educated decision about your Medicare, whether it's supplements, prescription drug plans, trying to see if you qualify for subsidies and things of that nature. So we do not sell insurance. We are not insurance agents. We do not get commissions. So that's my disclaimer. The objectives for today is to, you know, just cover the basics of Medicare. If we went in depth, we could be in here for a few days trying to cover everything. So I'm just going to hit the highlights of this presentation. I've gave you a bunch of handouts. Some of those we will touch on, some of them we won't. And you know, if you're bored at home, you can use that as light reading. And then if you have any burning questions after you go through all of that stuff, I'll give you guys my card at the end and you can touch base with me then. So Medicare 101, the basics. So understanding Medicare, we're going to look at what is Medicare and who is eligible, the 4 parts of Medicare, programs for people with limited income and resources. Medicare is a federally, I'm tongue-tied because Teresa's taping. Federally sponsored individual health plan providing coverage for medically necessary procedures and services. Medicare coverage requires co-pays, co-insurance, and deductible payments that are the responsibility of the beneficiary, which is you guys. You are the beneficiary, or secondary insurances. So, how many people are new to Medicare? You're going to be new? Yeah, you're going to be new. Okay, we got a lot of newbies. That's great. So, these are the folks that are eligible. Anyone age 65 or older who has participated in Social Security, the Railroad Retirement System, or employees of federal, state, or local governments, or who has had a spouse that has participated in those programs. Individuals under 65 that have been awarded Social Security or Railroad Retirement Disability after 24 months. Those disabled due to ALS, and individuals with end-stage renal disease. The ALS and the end-stage renal, you don't have to wait a specific amount of time. Once you're diagnosed with those things, you're automatically qualified for Medicare. The folks that's under 65, you can start drawing your Social Security check, but you have to be considered disabled for 24 months. Sometimes they will go back retro and pick up, and then sometimes it seems like they got it automatically, but most of the time they have to wait for 24 months before they're eligible for Medicare. So there's 4 parts of Medicare that we're going to try to touch on today. Part A is your hospital insurance. Part B is your medical. Part C, and I will probably refer to that mostly as Medicare Advantage plans, because that's what I'm used to it being called. And then Part D is your Medicare prescription drug coverage. So that's the 4 parts of Medicare. So have you all got your cards yet? If you're new, you already got your card? You already got your card?
Right.
Okay.
No, I'm actually not quite 65.
Okay.
But I'm just learning.
Okay. So these are the things that original Medicare covers. Your Medicare Part A, of course, is your hospital coverage. So it covers inpatient hospital, skilled nursing care in a facility, and that requires a minimum 3-day prior hospitalization, home health care, hospice, and blood. So the inpatient hospital coverage, sometimes you can go to the hospital and actually be there a couple of days, but you are not considered inpatient. So you need to kind of try to figure that out so you'll know how you're going to be billed for that stay, because they can keep you under observation or as an outpatient. But if you're in there and you're thinking you're going to need skilled nursing care in a facility, that requires a minimum 3-day prior hospitalization. So just to keep that in mind. Part B, which is your medical, it covers physician services, outpatient surgery and services, home health care, durable medical equipment, and blood. So that's the things that are covered by your Part A and your Part B. So, and that's what comes on your little red, white, and blue card initially. Hospitalization is A, Part B is your medical. These are things that are not covered by original Medicare: outpatient prescription medications, routine dental care, routine vision care and eyeglasses, hearing aids, foreign travel, cosmetic procedures and treatments, and long-term care. So those things are not covered by original Medicare. So the cost for most people, your Part A is premium free if you have worked and paid into the FICA tax system, 40 quarters, which is equivalent to 10 years. So if you've paid in for 10 years, you usually get that premium free. If not, then there will be a premium for that, and just depending on how much you've paid in or have not paid in, that can vary between $400 to $200. So, and that's the current amount. But for most people, they get the Part A for free. There's premium free. And now Part B for right now, 2019, and I'm not sure if that amount is going to change for 2020, but the Part B monthly premium is $135.50. They generally take that out of your Social Security check, so most people don't miss it. We got theme music, y'all.
Sorry about that.
That's okay.
So sorry.
And then some folks will qualify for some programs to pay for that $135. So we'll touch on that later as well. So if you are one of the fortunate folks that your income is more than $85,000 if you're a single person, or $170,000 on a year if you're a married couple, then you'll pay more for your premium. So I think we've run into maybe one person that fell into that category in all my years of counseling, that their income was higher, so they had to pay a higher Part B premium. That premium is typically auto deducted from your Social Security retirement benefit. So they try to take that out off top, so most people don't miss it unless your income is fairly low, and then you will miss it. But like I said, there are opportunities to see if you qualify for assistance to get that paid. So automatic enrollment, and it's your automatic is supposed to be enrollment. I still urge people to contact Social Security just to make sure. If you're collecting Social Security retirement benefits prior to age 65, people under 65 entitled to Social Security disability benefits, you will receive your Medicare card in the mail. It's showing you're automatically enrolled in Part A and B. It'll tell you when that's going to be effective. You can decline the Part B, but if you do, you need to contact Social Security and let them know you're going to send the card back, and then they'll send you another one with just showing your Part A effective date. And really, the only reasons you would decline that is if you're going to have coverage somewhere else for Part B, like through an employer group plan, or if it's your spouse's employer group plan. So you really want to make sure you have some other coverage before you decline taking it. Because if you don't take it when you're eligible for it, and you decide to take it later on, you're going to incur a penalty if you didn't have credible coverage somewhere else. So, and usually that coverage begins on the first day of the birth month, unless your birthday is the first of the month. In that case, it would start the previous month. So, did that confuse you?
Absolutely.
Did it? So, if you're born on April the 1st, instead of your Medicare becoming effective in April, it would have became effective in March.
Okay.
So,
I got it.
okay. And this is what I was talking about, your initial enrollment period. So when you get your card, you have like this window of time to get everything in place so you don't get any penalties. You have 3 months before your birthday, the month of, and the 3 months after. Now if you're drawing disability, same thing, it's the month of your effective date. So you have the 3 months before your effective date, and then 3 months after to get everything in place so you don't incur a penalty. So that means getting a drug plan, or getting enrolled in an Advantage plan, and making sure you're in your Part B. So you have that window of time. And then some people are early birds and they start at the first month before, and that's awesome. Just people need to remember, just because you get enrolled early doesn't mean your coverage starts early. So it will start once whatever the effective date says on your card. So general enrollment people, and that's for those that do not enroll during their initial enrollment period, is January 1st through March 31st. Say, for example, you're new to Medicare, but you're still receiving benefits through a former employer, and that is going to be your primary insurance. So you don't necessarily have to take Part B. Or you may lose that coverage and decide you want to pick it up. You can pick it up during January 1st through March 31st. So that's the general enrollment period. And then your coverage will start in July if you enroll during that general enrollment period. So failure to enroll in Medicare when you're initially eligible may result in a 10% premium penalty for one's lifetime for each 12-month period you're not enrolled. And that's why I said if you don't have coverage somewhere else and you do not get enrolled in your Part B during your initial enrollment period, and you decide 2 or 3 years down the line, I'm going to pick up Part B because I have all these medical issues and I can't pay for it out of pocket, then they're going to add 30% to your Part B premium, which is $135 right now, but who's to say what it's going to be in 3 years, and that will go with you the entire time that you have Medicare. So it's good to get things done in advance. I know people don't like to give their money away, but it's better to get in on the front end than on the back end and have all of this extra penalty attached to your premium. So this can be waived if you delay because of your primary care coverage, your employer group health, if you're covered or your spouse is covered. As long as you have coverage somewhere else, you're good until you lose it. So special enrollment periods, we have several of those with Medicare. If a beneficiary or their spouse are actively working, you can delay enrolling into Medicare Part B. The Medicare beneficiary or their spouse is actively working for an employer providing the group health insurance coverage. If you're older than 65, then your employer must have 20 or more employees in order for it to be considered your primary insurance coverage. If you're younger than 65, then your employer must have 100 or more employees for it to be considered primary. So if you lose your employer coverage, you sign up for Part B and Part D, which covers your prescriptions as soon as you can. But Part B, if you lose that coverage, you have an 8-month window to enroll without penalty. So that's where this is a special enrollment period. You don't have to wait to that general enrollment period of January through March. You have a special enrollment period because you had something that altered what you had as far as coverage. So the sooner you enroll in Part B, the sooner your coverage will begin. Enrolling in Part B also triggers your 6-month Medigap open enrollment period. And we'll touch on Medigap. That's a supplemental plan that some folks purchase to pick up what Medicare, original Medicare does not pay for. But that will give you a guaranteed issuance period, no matter how long it's been since you delayed taking your Part B. With Part D, you have a smaller window of time to get enrolled without incurring a penalty. You only have 63 days to enroll in Part D plan without penalty. And your plan will begin the first month of the following month that you enroll. So, okay, if you lost your drug coverage to an employer this month, you have 63 days to get a plan. If you enrolled in something this month, it would start in what's the next month? October. If you waited to October, it wouldn't start until November. So whatever you do the previous month takes effect the next month. So these are the ways you can enroll. Medicare enrollment is handled by the Social Security Administration. It can be completed online at www.ssa.gov, or you can call their 800 number, or appointments can be made through the local office. I know we have a local office in Asheville. Not really sure where the other ones are located. In Hickory. Okay. So, and I have phone numbers for those. If you ever need them, you can give me a call and I can make sure you have those. So, they mentioned Medigap ahead of time, and people get Medigap plans and Advantage plans mixed up, and we're going to talk about both. But Medigap plans are standardized insurance plans that's designed to fill in the gaps, because original Medicare is 80-20. Once you meet your deductibles, they will pay 80%. You're responsible for the 20%. So a lot of people like to get these Medigap plans if they can afford to do it. But they generally pick up the deductibles, the co-pays, and the co-insurances. So if a person can afford it, and you have a lot of hospital stays, a lot of doctor's appointments, it kind of works out because you generally don't have any out-of-pocket costs when you have hospital visits or medical visits, unless it's for prescriptions, because Medigap plans do not cover drugs. They are designated by letter codes. Each plan, whether you choose a C plan, whether you choose an F plan, they have basic things that they cover. The difference is one plan may charge $100 and the next plan may charge $500, but they all have to cover the exact same thing. So, if you go with this option, anytime you went to the hospital or the doctor, you would take your Medicare card and then you would take your Medigap supplemental plan card with you. So whatever Medicare does not pay for, your Medigap plan usually picks up. So and people get that confused with Medicare Advantage because that's a whole different animal. So and some folks have secondary coverage. Medicaid, some low-income individuals do qualify to have full Medicaid, or they can qualify for the Medicaid that pays your Part B premium. So there is a program available for some folks to get that paid, $135. That's what it is now, but that you have to apply for that through DSS. So some people do qualify for that. TRICARE for Life is for the military retirees and their dependents. Federal and state plans for retirees and dependents, and then of course your employer group health plans. If you have an employer group health plan, it would be the same scenario. If you go to the doctor or the hospital, show both cards. Medicaid, if you have full Medicaid, if you go to the doctor or the hospital, show both cards. So when they're filing your claim, they can see who's primary, who's secondary, and who pays what. So with Advantage plans, you're just going to have one card. So it'll never be you showing two cards if you're in a Medicare Advantage plan. So some employees offer a variety of coverage options to retired employees. So some people offer cash benefits. So I know one of the companies here in McDowell County, they have an exchange you have to go through. They give you so much, an allotment for your services, but you have to go through their exchange in order to do that. So, and we've had people come to us and we not know that was their situation, and you enroll them in a plan, then they lose that money to pay for that. So it's always good to know if you're getting ready to retire or you're going to be receiving some benefits from your former employer, to see if you have to go through an exchange to get your insurance coverage so you don't lose that money. So many employees are offering sponsored Medicare Advantage plans. I know the state health plan uses just one insurance company for their coverages. So they have a type of an Advantage plan. Theirs are a little more flexible than the Medicare Advantage plans through Medicare, because they can use it at other places that you can't use a Medicare Advantage through Medicare. Okay, so then the only source of that information is through the Employer Benefits Administration. I can't tell you what company ABC provides their employees. So that's your responsibility to check that, so you don't miss out on an opportunity to have benefits that you're due. So I always tell folks, if you're getting ready to retire, if you're going to get any type of benefits package from your former employer, talk to your benefits administration to make sure you are on the same page. So whenever you come see me, we don't end up enrolling you in something and knocking you out of getting something that you were due. So Medicare Part C, Medicare Advantage is what I call. I don't know why they put Part C, but Medicare Advantage, that's a health plan option, and it has to be, those plans have to be approved by Medicare. It's another way to get your Medicare coverage. It's kind of like employer group health insurance. It includes your hospital, your medical, and your prescriptions all on one card. It's still a program of Medicare, but it's run by private companies, and these companies have to be approved by Medicare in order to participate. Medicare pays the plan and amount for each member's care. So I know you start getting all this stuff in the mail about Advantage plans. You see all of these commercials on TVs about Advantage plans. It's free. It's free. It's free. It's not free. The $135 that they take out of your Social Security check for Part B goes to that plan. So If $135 is all they're asking for that plan, then it will seem like it's free because it'll show that it has zero premium. But if the plan shows that it has a premium of $50, so you're sending them $50, Social Security is sending them $135, so in essence, you're really paying $185 for that plan. So, don't be fooled by the free. So, you may have to use network doctors or hospitals, and you always need to check with your healthcare providers. So, that's where your homework comes in if you're leaning towards an Advantage plan, because they are based on your zip code and your county. You usually can't use those out of state, out of the country. For the HMOs, you definitely have to stay in network, so all your providers need to be in network, and if you go outside of network, you're going to pay full cost. And when you call to check with these places, you just need to be specific when you're asking questions. Don't ask, do you take this insurance? Because they'll file anything. It doesn't mean they're in network. Ask them if they are in network with that plan before you sign up to have any services done. So you're not shocked and have a bill that's full price and you're thinking, well, they said they take my insurance. Yeah, they'll take it and file it, but if they're not in that network, you're still going to end up with a full cost bill. PPOs, that's preferred providers, they have a list of doctors and hospitals and specialists that they want you to use. You can go outside of those, but you will pay a higher percentage, and it's usually more than you would pay with original Medicare. So that's some things that you just need to be mindful of if you're leaning towards Advantage plans. A lot of people like them because you've worked forever and you've dealt with employer groups, so well, when I go to my doctor, I'm gonna pay $10 copay. If I go to a specialist, I'm gonna pay $50. My medicine is gonna cost this much. So a lot of people like that model, and if they do their research and know definitely who's in network and who's not, it kind of works for them, but it's a lot of homework to it, because once you make these decisions, you're stuck until the open enrollment rolls around, October 15th through December 7th. That's my busy season. So everybody that is enrolled in Medicare, I always suggest that they do a comparison of their drug plan and see if it's going to be the better plan for them for the upcoming year. You can also look at your Advantage plans during that time too. But like I said, once you choose a plan, you're stuck in that plan until open enrollment comes back around, unless you qualify for extra help. And if you qualify for extra help, you can switch plans every quarter. It used to be once a month, but they've changed that to quarterly because I guess they had a lot of people that was getting in a plan one month, getting out, getting in another, and it takes it a while to catch up. So they kind of streamlined that now. So the folks that's receiving the low income subsidy, or the folks that are dual eligible, which means they're receiving Medicare and Medicaid, they can switch plans every quarter. The only other way you could switch plans if it's not time for open enrollment is if you move to another zip code or another state, then you have that special enrollment period. And these are the ways you can enroll in a Medicare Advantage plan during your initial enrollment period, during open enrollment, and we've touched on that, and we've touched on the special enrollment periods. And like I said, if you move to a different county or state, or if you qualify for extra help, and that would grant you a special enrollment period, and you could get out of the plan that way. And another thing about those Advantage plans, while I'm thinking of it, they can decide not to participate before the year's over. We had an issue with that. One company decided that they didn't want to be in network with the local hospital system, and we had a lot of people that had that plan, and they couldn't switch plans just because they decided to drop it during the middle of the year. So those folks were kind of stuck for a little bit. So that's another thing to be mindful of too. They can decide that I don't want to fool with y'all anymore. Yeah. So we're done. But they worked that out. But I mean, there was a lot of people that switched plans that wouldn't have normally switched plans just because of that incident. And that's the plan they preferred, but they were scared to stay with it because they didn't know if it was going to work. And that's where all their providers were. And this is a decision comparison of how original Medicare works versus Medicare Advantage. So original Medicare covers your Part A and your Part B benefits. Medicare provides this coverage directly. You have your choice of doctors and hospitals that are enrolled in Medicare and accepting new patients. Your supplement coverage pays deductibles and co-insurances if you decide to do a Medigap. And you usually pay a monthly premium for Part B. Like I said, some people are an exception to that rule because they qualify for extra help to pay for that. So Advantage plans, they cover Part A and Part B benefits, and some may cover additional benefits. And this is the oohs and ahs that get some folks into the Medicare Advantage because they say they cover vision, dental, and hearing. And as we've seen earlier, original Medicare does not cover those things. So that's how folks get attracted to Medicare Advantage plans. That coverage is provided by a private insurance company, and they have to be approved by Medicare. In most plans, you need to use plan doctors, hospitals, and other providers, or you pay more or all of the costs. You may pay a monthly premium in addition to your Part B premium and a co-payment or co-insurance for covered services. So Part D, that is your prescription drug coverage, and you know that's not included with your original Medicare A and B. It would be a great world if all of that came on one card, but it doesn't, so you have to choose your drug plan. Anyone that's covered by Part A and or Part B is eligible to join a Part D plan. These are also sold by private insurance companies, and they require payment of monthly premiums. There are programs through the Social Security Administration that will help you pay for your drug plan premiums and co-pays, and we'll talk about that later. Each plan covers a group of prescription medications. This is called your formulary list. And the reason you do comparison is because Plan A might cover your drug, Plan B may not cover your drug. So it's a good thing to do a comparison to see what drugs are covered and what drugs are not. Because you might take a plan just because you know your sister has it and she does great with it, but you might take it and it might not cover the majority of your drugs. And then once you're in there, like I said, you're stuck until open enrollment rolls around again and you have a plan that you're paying for that doesn't even pay for your medication. So that's why you need to do a comparison for that. They usually have co-payments for prescriptions and an annual deductible. All plans don't have a deductible, but most do. The highest was $415 for 2019. I'm not sure what it's going to be for 2020. We haven't got those numbers yet. So, and those lists change annually, and that's why it is important to do a comparison during open enrollment, because your plan might cover your drug for this year. Next year they may decide this is not a drug that we're going to cover, and then if you don't do any comparisons and you're like, well, I'm not going to change plans or even look to see, and you stay in that plan, and then guess what? You go to the pharmacy, try to pick up your medicine, and see you have to pay full price with it. You're scratching your head like, why am I having to pay for this? Well, it's because they took it off their formulary list. And they should send you a booklet every year so you can see what's on their list. And I suggest, even if you're going to the doctor and you're going to get any new medications, refer to your formulary list to make sure it's on there before they prescribe it. So, and I've mentioned this extra help program. It's financial assistance available for people with limited income and assets. They check your total income before they take anything out of it. Like if you're using your Social Security, for example, you need to add back the $135 so you know the full amount. So there's a brochure I gave you all with a brief overview of SHIIP and what it's all about, and the income amounts are inside. That tells you how much you can make as an individual or as a married couple to see if you qualify for the extra help. Those numbers do change once the federal poverty level comes out. So this may change for 2020. This amount that you are allowed to earn and the assets you're allowed to have, that may change once they get that new information. The Part B premium may change once they look at that information, but they've not sent us anything saying any of this has changed as of yet. The extra help program can reduce or eliminate monthly premiums. The Social Security Administration, if you qualify for this extra help, you can qualify for full extra help or partial. So just depending on how much of a subsidy you're going to get, it will still eliminate your costs. I mean, some people end up not paying a premium at all for a drug plan, and then some just have a small amount that they have to pay, but I mean it saves people money. And this is where I was talking about the quarterly changes. So those people qualify to change their plans every quarter if they need to, whereas people that don't qualify, you're stuck. And this same thing for Part D. You can enroll during your initial enrollment period, during the yearly open enrollment period, and at other times you can join. Everything has a special enrollment period. So if you've been on Medicare and you've got a Part D plan and you've been getting it for years and something changes and your income is drastically cut and you end up qualifying for extra help, then you can switch plans once you become eligible for extra help. So that would grant you a special enrollment period. So this is the differences between Medigap plans, which are supplemental, and then Advantage plans. So Medigap plans, they are through private companies, and the government oversight works with the state, but it must also follow federal laws. It works with Original Medicare, and it covers the gaps in Original Medicare coverage, like the deductibles, co-insurance, co-payments, and this for Medicare covered services. You have to have Part A and Part B in order to get a Medigap plan, and you do have a premium for the policy, and you'll still pay the Part B premium. So if you go that route, you're going to have a premium for your Medicare Part B, a premium for your Medigap, and then you'll have a premium for your drug plan. So Advantage plans are offered by private companies. The government oversight works with the federal plans, must be approved by Medicare. It does not work with Original Medicare. Like I said, once you choose a Medicare Advantage plan, if you go to the doctor, you just take them that card. Don't take them your Original Medicare card plus that Advantage plan card, because you're not going to be able to use it. And that's where a lot of people get confused. They think that an Advantage plan is a supplement and you can use both cards. Medicare is going to pay for this, and then the Advantage plan is going to pay for this. No, it takes the place of Medicare. All Part A and Part B covered services and supplies are covered. It may also cover things not covered by Original Medicare, like vision and dental. And most plans include Medicare prescription drug coverage. And you must have Part A and B, and you will have a premium if it's extra. I mean, they're going to take that $135 out of your check, but if it has an extra premium, you have to pay that as well. So that was the real quick overview. This kind of shows you your Medicare covered choices. Your first choice is Part A, Part B, that's your Original Medicare, and you can add the Part D for your medications. Your second scenario is Part A, Part B, you got your prescription drug plan, then you decide to get a Medigap plan. So that's your option 2. Your last option is a Medicare Advantage plan, and like I said, that usually covers your medical, your hospital, and your drugs all in one card. And that's the real quick down and dirty overview of Medicare and your coverage choices. So these are places you can get help. This is the main SHIIP number in Raleigh, but like I said, this is the coordinating site here. I'm the coordinator for McDowell County, so you can always call us local. We're pretty flexible. We have about 10 volunteers. 3 of us do one-on-one counseling. So and if we don't know the answer to something, we can get you linked up with the folks in Raleigh. The Social Security Administration, and then Medicare. And DSS is also a good resource, because like I said, some people do qualify for the program to pay their Part B premium, and they would have to apply through DSS for that. But like I said, a lot of people get confused when it gets time to doing the comparisons, because it is a lot of information. And you want to make sure that you know you're making the best decision for you, because like I said, for most people, once you make that decision, you're stuck until open enrollment rolls around every year, October 15th through December 7th. And I encourage everybody that's enrolled in Medicare to use that time to do a comparison to see if your current plan is going to be the best one for the next year. So that's what we're all about. Folks making wise decisions based on their finances and what is going to be best for your health care. Just because your neighbor has a certain plan and it works magnificent for them doesn't mean it's going to work for you. So it is very important to do these comparisons. So
where can people apply for the extra help?
the Social Security Administration on their website, or they can make an appointment with one of the SHIIP counselors, and we can do it. So we can assist you with doing those applications. We can enroll you in drug plans. We can enroll you in Medicare Advantage plans. We cannot get you into a Medigap plan because we do not sell insurance. We do this free, no commission. It's a free service. So we are a resource. So y'all spread the word. Spread the word about the extra help, because I know there's a lot of folks in your communities, your churches, your families that might benefit from that subsidy. So, and we try to get the word out. So that's my presentation. Any more questions? Yes.
How do we set up an appointment with you?
Okay, so there's a form in your packet. It looks like this. So, but you can go ahead and fill this out, front and back, with your demographic information, your Medicare information. On the back side, there is a place for you to list your drugs, the strength, the daily dosage, and your preferred pharmacy, and you can leave that at the front desk. If you want to see me specifically, make sure you put my name on it, so I'll get it. So I'll get that, put your stuff in the computer, give you a call and set up an appointment as it works out with my schedule, because I do a lot of stuff around here. So, and again, open enrollment's October 15th through December 7th. If you're new to Medicare, once you get your Medicare card, same process. Come pick up one of those papers, fill it out. You can leave it at the front desk. You can call me and request that I email it to you or send it out in the mail. It's however you want to receive it and get that information back to us.
But do you encourage people to like come back every
I do.
enrollment just so they can compare and see if, okay.
Because like I said, those plans change their formulary list annually.
Yeah.
A drug you're taking this year may be covered on that plan, but next year it may not. The premium may go up, the deductible may go up, and it might be something cheaper with another plan. Like I said, it's hard getting people to do that because people don't like change. I'm in it. I'm just gonna stay in it. It's not any major changes, but then some people, I know we've counseled some people and saved them thousands of dollars just by having them switch to a different plan or applying for the LIS form, and they get that subsidy and it saves them so much money. So, and they're very appreciative, you know. If you've been on it for a while and you already have a plan, if we look and see that you don't need to make any changes, we'll give you a call and give you an overview over the phone. If you don't necessarily want to come into the office, we can do the comparison over the phone, and if you want me to enroll you, we can do it over the phone, and then I'll send you a confirmation and all of that in the mail. I have people send stuff to me via email, and I'll send them back the comparisons via email, and then we'll so there's various ways to get assistance, and some people just like the one-on-one face-to-face. And we do the one-on-ones, and I have a screen set up so you can see what I'm doing while I'm doing it. So, because I'm a visual person, so I want everybody to be able to see as I'm explaining. So
if you have Medicare because of a disability, you're getting disability, and you don't enroll in the Part D, once you turn 65, you're eligible to
you have that initial enrollment period for that and a Medigap plan.
And if you didn't take the Part D before, you don't have to pay the penalty?
Not once you turn 65.
Okay.
That and if you have if you qualify for LIS, that penalty is waived as well. So that's the ways to avoid it. Do it on time. Get extra help, or like if you're on disability, once you turn 65, you have all those advantages of a person that's newly into Medicare. It's kind of like you're new because you're coming into Medicare based on your age, not a disability.
Right. We see a lot of people who didn't go with the Part D because at the time they didn't need it. They weren't taking anything, and
that's why I tell folks, even if you're not taking any type of medications, once you become eligible for Medicare, take the cheapest plan, just so you have one and you're not penalized. Because I'm telling you, on down the road, you're going to get some type of illness and you're not going to have some coverage, and then you're going to be like, oh shoot, I should have got that. Now I'm paying double of what I would have paid if I would have went ahead and done it when I was, my initial enrollment period. So it pays to be progressive. Any more questions? Well, you guys have been great, and you participated and you asked questions, and I appreciate you giving me some of your time. And one more thing I want to touch on, fraud is really big with Medicare. So whenever they send you out your Medicare summary notices, make sure to check those and make sure your dates are correct. The provider, the service they provided, it'll show you how much you paid, how much Medicare paid, and if you have any supplemental insurance, just to stay on top of those and make sure you're not being double billed for stuff. And if you have any red flags, on your Medicare summary notices or anything that you need to do an appeal on, you can contact the Raleigh office and they can help you do that. So, because fraud is big, especially with durable medical equipment and stuff like that. You know, you see the commercials on TV where you can get a back brace for free, or you can get a scooter for free, and all of this different stuff. So that's huge. Yeah.
That's the Raleigh office, that's the SHIIP office?
Yes, the SHIIP office, and that information is in that brochure. And like I said, these are really good handouts. Like if you're gonna be new, planning your drive to 65, it's kind of like an overview. And this Medicare Basics, it has a lot of information. Also on the back side, your preventive services, stuff like mammograms, colonoscopies, different screenings. It's preventive screenings. They're covered mostly at 100%. And there's certain times your yearly wellness visit. You're welcome to Medicare one-time visit. Flu shots, glaucoma tests, just different screenings. Look at this list and make sure you're taking advantage of those screenings, because prevention, you know, that can save you from a lot of stuff if they can catch stuff early. So we encourage you to take care of yourself and use your preventive services. So
Thank you very much.
well, you're welcome.